Case study on endosulfan tragedy in Kerala. Endosulfan is a pesticide or insecticide that is used in crops in order to prevent the pest or insect attacking this crop. It can be either sprayed manually or it can also be sprayed aerially. This endosulfan is very famous due to its very high efficacy, and also it was available at very low cost. This endosulfan is available in the market by various trade names. An empty packet of endosulfan was seen in the cardamom plantations of Idukki district by another trade name. So, for over 20 years, cashew plantations in Kasaragod district in Kerala, which belonged to the Plantation Corporation of Kerala, used endosulfan as a pesticide. So, atmospheric transport of endosulfan led to the health effects in the citizens. In Kasaragod, the aerial spraying began in 1976. A few years later, there were reports of calves being born with deformed limbs. Frogs, fishes, bee colonies, fireflies, and jackals vanished from these areas, and many local children and large number of people below the age of 25 were suffering from severe disorders. And also many water bodies around the plantation was found to be contaminated due to the persistent nature of endosulfan in soil. And also the villagers were also directly exposed to the spray drift. So in Palakad's Mudalamada Panchayat, endosulfan was used extensively in the mango farms. There were reports of animals who gave birth to offspring with deformities, and residents witnessed the death of monkeys, reptiles, and thousands of butterflies each day. So what is endosulfan? So endosulfan is an chlorinated hydrocarbon, and it is persistent organic pollutant. That means it remains persistent in the environment without degrading physically, chemically, or biologically. And it is used in cashew nut, coconut, and rubber plantations. And it's also a bioaccumulant. That means it accumulates in the body of the organism either through water, food, or air. Then physically it appears as a brown or colorless crystalline solid with a very pungent odor similar to that of turpentine, and it is more dense than water, and it's also nearly insoluble in water. Endosulfan is a cyclic sulfite ester. The IUPAC name of endosulfan is 6789110 hexachloro 155A 699A hexahydro 69 methano 243 benzo disulfene 3 oxide. Now, structure of endosulfan. Technical grade endosulfan formulated for occupational use. It is a mixture of two isomers, that is alpha endosulfan and beta endosulfan. Alpha endosulfan is found to be 3 times more toxic than beta endosulfan, and this is the cyclic sulfite ester form of endosulfan. Now coming to the endosulfan in the environment. So endosulfan is applied as a pesticide in crops like broccoli, potatoes, cotton, etc. So it enters the atmosphere through agriculture applications and can be transported long distance in air. So due to the spreading of endosulfan in the cashew nut plantations, as a result of endosulfan persistence in the soil and the soil being carried to the streams as storm water runoff, it reaches the lake and pond. Endosulfan is persistent in the environment, so it biomagnifies in both terrestrial and aquatic food chains. Now coming to the routes of exposure. Dietary exposure by ingesting food sprayed with endosulfan or by drinking water contaminated with endosulfan. Occupational exposure via topical or inhalation routes during mixing, loading, and or applying endosulfan, or by immediately re-entering the endosulfan treated areas. And also high residues of endosulfan in the blood of teenaged boys. Endosulfan attached to soil particles entered the body through dermal route. Through injection in children who are mostly involved in hand-to-hand behavior. In children also through breastfeeding. Injection, inhalation, and percutaneous exposure. The majority of the workers in the cashew plantations were not provided with proper safety precautions. So these workers were identified with skin diseases, enlargement of lymph nodes, chronic asthma, and even death by cancer. The situation was agitated by the lack of regular medical checkups and the unavailability of medical attention when prompted. Minimum risk level. Oral doses of endosulfan above 1 mg per kilogram per day for 36 to 105 days led to hepatotoxicity and renal toxicity. Endosulfan have high acute oral and inhalation toxicity, whereas slightly toxic dermal toxicity. Orally, it was highly toxic, inhalation, it was moderately toxic, and dermal, it was slightly toxic. According to United Nations Environmental Programme, ADI, acceptable daily intake is found to be 6 microgram per kilogram, and ARFD, acute reference dose, it is the estimate of the amount of pesticide in food or drinking water that can be ingested over a period of 24 hours without appreciable health risk to the consuming person. It was found to be 1.5 microgram per kilogram. According to ATSDR, it is the Agency for Toxic Substances and Disease Registry. Minimum risk level for acute oral exposure was found to be 5 microgram per kilogram per day, and minimum risk level for chronic oral exposure was found to be 2 microgram per kilogram per day. Now coming to the toxicokinetics, the principal toxic effect of endosulfan is neurotoxicity, that is central nervous system hyperstimulation characterized by seizures. Its potent neurotoxicity is attributed to chloride channel antagonism as well as inhibition of calcium and magnesium ATPase enzymes involved in the transmission of nerve impulses. Patients usually exhibit hepatic, renal, and cardiac toxicities upon endosulfan intoxication, and severe poisonings are characterized by complications such as kidney failure, nausea, vomiting, rhabdomyolysis, hypotension, confusion, tremors, and coma. Acute toxicity is on the nervous system, causes hyperexcitation and convulsions, and nervous system mediated effects on respiration and heart. Death results from low levels of exposure. Long-term toxicity. Endosulfan is mutagenic and genotoxic. Birth defects. Long-term neurological effects such as epilepsy and may cause Parkinson's disease. It is toxic to and suppresses the immune system as well as promoting allergic responses. Endosulfan is an endocrine disruptor. It is estrogenic and anti-androgenic in human cells and causes breast cancer cells to grow. Endosulfan interferes with male hormones, causing chronic depression of testosterone. Absorption and distribution. Due to the hydrophobic nature, the endosulfan tends to get adsorbed to soil particles, resulting in persistence. Absorption through the gastrointestinal tract is very rapid, with greater than 19% absorbed. Endosulfan does not get accumulated in the tissues of mammals, but undiluted endosulfan is slowly and incompletely absorbed in the gastrointestinal tract of warm-blooded animals. Conjection of meningeal vessels. Absorption through the skin has been as high as 50%. Endosulfan is absorbed across the skin, and absorption is increased with oils or lotions on the skin and through cuts. It has been found distributed to adipose, liver, kidney, heart, spleen, testes, epididymis, prostate, seminal vesicle, milk, and muscle. Endosulfan upon oxidation forms endosulfan sulfate, which is more toxic than the former. Hydrolysis of endosulfan result in the formation of endosulfan diol, which may further get converted into the less toxic metabolites like endosulfan ether, endosulfan hydroxyl ether, endosulfan dialdehyde, and endosulfan lactone. Renal and hepatic routes are the two major routes of excretion. Renal excretion is seen in humans, while hepatic excretion is seen in animals. Half-life is approximately 7 days. Alcohol may interfere with the metabolism of endosulfan, which delay its elimination from the body and increasing its toxic effect. Endosulfan has an affinity with the gamma-aminobutyric acid receptors in the brain, and it acts as a non-competitive gamma-aminobutyric acid antagonist. Binding of gamma-aminobutyric acid to its receptors induce the uptake of chloride ions by neurons, and blockage of this uptake by endosulfan result in a state of uncontrolled excitation. The primary biomarkers for endosulfan exposure include tissue and excreta concentration of endosulfan and its metabolite endosulfan sulfate. 78% of the male children sampled had significant levels of endosulfan in their serum, mean 7.47 microgram per liter, and this was still significantly higher than a control group 10 months after spraying of endosulfan ceased. Death of at least 4,000 people and also induced chronic health ailments in more than 10,000 residents of the affected area. Neurological complications as well as congenital and reproductive abnormalities among the affected people. Endocrine disruption resulted in health implications in future generations. People in the affected area also suffered from severe central nervous system disorders, blood and liver cancer, topical diseases, asthma, psychiatric disorders, and suicidal tendencies, infertility and undescended testes among males, miscarriages, and hormonal irregularities among females. Exposure to endosulfan at very low concentration even caused breast cancer. Congenital deformities of hands, feet, and heart, especially in females, endometriosis, early menarche, frequent menstrual disorders, male breast enlargement, liver cancer, hematological cancers, brain tumors, congenital mental retardation, cerebral palsy, delayed mental and psychomotor development, learning disabilities, low IQ, psychiatric disturbances including committing suicide, epilepsy, frequent illness, skin diseases, ear, nose, and throat problems, vision impairment, and full loss of vision. The most affected group in the disaster were children and infants who had suffered from permanent disability and disfigurement. Most of them are having severely bruised thin legs and knees, large head with an extremely feeble body. The majority of the victims exhibit congenital anomalies, physical deformities, mental retardation, cerebral palsy, epilepsy, and hydrocephalus as an aftermath of endosulfan exposure. Delay in sexual maturity among boys, congenital deformities including a child born with a bladder outside her body. Endosulfan contaminates breast milk, adipose tissue, placental tissue, and umbilical cord. Hence, the unborn child was exposed and then re-exposed on birth through breast milk, both exposures taking place at critical periods of development. Environmental effects. Animals, birds, and insects that were predominantly seen before the endosulfan revolution started gradually disappearing as a consequence of the insecticide spraying. These organisms include hog rats, squirrels, crows, butterflies, fishes, frogs, and snakes. Absence of honeybees that were abundantly found in the past negatively impacted the source of income of local farmers. Water and soil samples in and around the plantation area revealed the presence of endosulfan residues even after 10 years since aerial spraying was ceased, indicating the capability of endosulfan to persist for a considerable period in the environment and exert its toxic effects. Endosulfan also poses a significant threat to the ecosystem due to its low degradation rate, high environmental stability, and long half-life. Acute and chronic risk for both terrestrial and aquatic environments. Aquatic toxicity. It was toxic to fish. It disrupts the aquatic food chain. In fish, it causes marked changes in sodium and potassium concentrations, decrease in blood calcium and magnesium levels, inhibits brain ATPase, and can cause massive fish kills. Terrestrial ecotoxicity. Endosulfan is immunosuppressive in bird species. Toxic effects on plants include altered permeability of root membranes, resulting in coiling of the root radicle, inhibition of root growth, stunting of shoots, and burning of the margins and tips of leaves. Early treatment is crucial since there is no specific antidote for endosulfan toxication. Symptomatic treatment often includes gastric lavage, limiting the aspiration of pesticides into lungs, followed by intragastric administration of 30% volume by volume magnesium or sodium sulfate containing activated charcoal. Benzodiazepines are preferred for treating convulsions, while topical exposure of endosulfan requires cleansing with soap water. All water bodies in and around the locality need to be covered to prevent exposure and contamination. Stomach pump, administration of activated charcoal, control of seizures by use of drugs such as phenobarbital, diazepam, midazolam, phenytoin, or phenobarbital. Then there are various technologies that are adopted to eliminate endosulfan from soil and water. In water, electrooxidation by boron-doped diamond anode, oxonation, femtone. In soil, adsorption with sawdust carbon, photocatalytic degradation with the illusion of surfactants, and if conventional techniques are not available for the removal of those organic pollutants like endosulfan, we can choose advanced oxidation process also. So these are the references from reference of journals and reports from which all the presentations were made, and many media reported this issue. These are some of the real images of the people as well as children affected from this endosulfan, and many protested, like famous personalities like Arundhati Roy, Dr. Swaminathan, Medha Patkar all protested in order to ban endosulfan, but due to its high efficacy as well as very low cost, it was very famous. And also even Excel Crop Care, Hindustan Insecticide Limited, Coromandel Fertilizers, who were responsible for manufacture of this pesticide, they also was protesting the ban. They were against the ban, but later in 2005 the government of India banned the sale and use of endosulfan in Kerala. By studying the various reports passed by National Institute of Occupational Health, Indian Council of Medical Research, Center for Science and Environment, Dubey Commission, in 2005 the government of India banned the sale and use of endosulfan in Kerala. Thank you.